Okay, great. So we can get started then. Yes, once again, welcome everyone to our last talk for the season on on artificial intelligence in healthcare. So before we do get started, as you'll see on the slide, so we are doing some research associated with this project. So there's a link and a QR code to our pre-seminar survey. So if any of you would like to fill that out anytime during the presentation or we will be having a 10-minute break, our intermission period. So if you would like to do so and fill out the survey, it certainly helps us out a lot and helps us get some valuable feedback from you and improve the quality of these presentations going forward. Okay. So just giving an outline of kind of where we've been and where we're at so far in the mini med school lecture series. So my colleague Michael started it off with a presentation on the new Canadian alcohol use guidelines. I then did a presentation on accessing a family doctor in BC. We had a presentation on skin conditions and concerns, depression in the elderly, Ozempic in other GLP-1 agonists, and finally, what brings us here today is the last presentation, the presentation on artificial intelligence, also known as AI in healthcare. So I do just want to put it out there that all of these lectures have been recorded and are available on Dr. Gair's website, which we will provide a link towards as well. So if you would like to watch any of these lectures that perhaps you've missed or that you're interested in, please feel free to do so. And if you would like, you would also be able to fill out the pre-seminar survey for any of these lectures as well. Okay, so once again, what brings us here today? Okay, so artificial intelligence or AI in healthcare. So basically what we're going to be doing today is first, I'll be giving a general overview of artificial intelligence for those who may not be familiar. And then we'll also be going over the some examples of some applications of AI in healthcare. And finally, we're going to finish it off with a bit of a talk on some potential concerns there may be regarding the use of AI. Okay, so a general timeline for today. So started at around 9. We do have the time until 10:30. I'm not sure if it'll take that long, but as I mentioned, there will be a 10-minute break or intermission period where if you guys need to uh, take a break, feel free to do so, and we'll also post the pre-seminar survey link at that time. And then we will end it with a 15-minute question and answer period at the end of it. So if you do want to submit any questions throughout the presentation, feel free to do so. You can just chat them. You can just put them in the chat box, and then we can either potentially answer some of them at the time, or the vast majority will probably just leave to the end to the Q&A period. So at any time, feel free to put some questions in the chat and we'll answer them at the end there. Okay, so a little bit about who we are. So my name is Derek. I'm joined here today by my colleague Michael, as well as our supervisor, Dr. Gair. So Michael and I were both second-year medical students at UBC. So Michael's at the Island program in Victoria, and I'm over in Vancouver. And before we get started here, just some general important disclosures to go over. So given that we are just second year medical students, we are not doctors. So yeah, this doesn't constitute as medical advice, and please consult your healthcare professional for any direct healthcare questions. And these sessions really for the purpose of providing a general overview on the topic and sort of an introduction to the topic. So some of you maybe uh, uh, have more information or be more experts in some of these fields than we are, but it's just to provide a general overview. And as I mentioned earlier, the session will be recorded and is being recorded currently for future viewing purposes. So if you do not wish to be recorded, please feel free to turn off your camera or microphone at this time. And I also would like to acknowledge that I'm joining you from the UBC Vancouver campus, which is situated within the traditional, ancestral, and unceded territory of the Musqueam. Okay, so starting it off, we'll start with the overview on artificial intelligence here. And to start that off, we're going to start with a poll to see where you guys are at. So here we go. So the question is, what is your current level of understanding of artificial intelligence or AI? So I'll launch the poll here. Yep. Yeah, so a few choices for you, very low, low, moderate, high, or very high. Okay, awesome. Looks like we're getting some great participation so far. I'll give about 5 more seconds and then we'll close the poll down and I'll share the results with you. Okay, closing the poll in 3, 2, 1. Okay, so as you'll see, it seems like the majority of you have a moderate understanding of artificial intelligence, and a few of you have low or very low understanding. So hopefully we can help improve that understanding a little bit today. Okay, so as a general overview here, so what is artificial intelligence, also known as AI? So it's essentially the use of machines to mimic human intelligence, thus the name artificial intelligence. And one of the ways that this artificial intelligence is used is for something called machine learning. Now, machine learning is where machines take in massive amounts of data that would otherwise be far too large for a human to be able to manage or analyze. So they take in this data and they analyze it. And from the patterns within this data, the machines are actually able to learn without needing humans to intentionally direct it. And one popular application of artificial intelligence currently is something called generative artificial intelligence. Now, what this is AI that can be used to create new things of a vast variety of different sorts. So this can be stuff like text, can be video, images, audio, and much more as well. And I'd say the most famous application of this currently is something that you may have heard of called Chat GPT. So essentially, this is a free chat bot online that anyone can go in and access. And it was created by a company called OpenAI. And what it allows you to do is input a question. So you type a question into that chat GPT, and it generates a response to that question. And this can be used for a vast variety of different applications. Now, currently, many people use it to understand certain topics or concepts, getting ChatGPT to explain a topic to them, or potentially to solve problems, to solve math problems, code programs, play games, write poems, even tell some jokes as well. So certainly, certainly, there's a lot of different applications for it currently. Although this is just one form of artificial intelligence, um, but it is being currently used by a large number of the population, which kind of brings us to our next poll here. So the question is roughly how many people are currently using ChatGPT? And I will launch the poll again here. Okay, so a few different options there, anywhere from 10 million to 200 million. Okay, we'll give a few more seconds here for any last responses. All right, so we'll close the poll in 3, 2, 1, and I'll share the results with you. So certainly sort of a spread distribution here, but the most popular response was 100 million. So let's see what the answer is here. So off of recent estimates, there are currently roughly 180 million users of ChatGPT, so pretty close to 200 million there. Yeah, so it's pretty clear that it is a very popular service at the moment. And that sort of brings us to our next major topic here, which is some of the applications of AI in healthcare. Yeah, so we went over a bit of a general overview and a popular example of AI currently, and I will talk about how this can be applied currently and in the future towards healthcare. Okay, so throughout this presentation, I'm going to be outlining some of the main ways that AI is currently being considered for healthcare use. And as an overview, here are some of the ways that AI is being considered for its use in healthcare. So one is to potentially improve the diagnostic process, so improving diagnoses. Another is reducing some administrative work. Another is drug discovery and helping with virtual health or rural health. And also, it has some applications for surgery. So before I start, I do want to just have a disclaimer here that I will be giving some current examples of the way AI is starting to be used within healthcare. So this is a rapidly developing and changing field. This is certainly not an exhaustive list, but it's just to give you some of the current and potential future general applications of AI. And it makes it a bit easier if I give you guys a name for it. So if you want to look into it a bit deeper, if you can feel free to do so. So I also will be mentioning a number of company names throughout the presentation. So these are just for the purposes of examples or for reference for you all. I'm not connected to or receiving funding from any of these companies in any way. Okay, so the first one that I mentioned there is improving the diagnostic process. So for instance, there is a Canadian startup called Meta Optima that allows for the analysis of retina scans and is able to diagnose accurately with 95% precision. And this algorithm has also received Health Canada licensing. So some other examples of this also include an AI-powered cognitive assessment tool. This is by Linus Health, which is a company based in Boston, which uses traditional tests to assess cognitive impairment and then puts us into a digital format while also assessing a number of other different metrics in order to determine a patient's level of cognitive function. So another major application includes the use of AI for the purposes of radiology and radiology diagnoses. An example of this could be a product that is able to analyze these radiology images, so things such as CT scans, X-rays, MRIs, and things of that nature that can help guide health professionals towards making a diagnosis as well. Now, these are just a few examples, like I mentioned. However, given that this is a rapidly developing and emerging field, there's certainly a lot more applications as well. But this is to give you a general idea for its impact on diagnoses. Okay, another area certainly worth mentioning as well is the application of AI within drug discovery. So an example of this includes the startup company called Cyclica, which is able to screen for millions of molecule combinations and potential efficacy against disease targets in order to come up with new and novel treatments. And one of the applications that they actually were able to do was that they were able to create a drug for COVID therapy, and they were able to do this within a few months, which is actually quite a quick timeline for drug discovery and development there. So another important area is its applications for reducing administrative workload. So currently, a significant amount of healthcare professionals' time is spent doing administrative tasks, whether that be charting, scheduling, note taking, or otherwise. And artificial intelligence can do this for doctors, such that they can spend less time doing these administrative tasks and more time interacting with patients. So a current example, that's actually be oh, okay. So a current example that's actually being done within a Canadian setting here is that of the work being done in Unity Health in Toronto. So something that's being done here is that so they created an AI tool which essentially acts as a scheduling tool and is able to assign nurses to their different posts and do scheduling and management of that. So this would significantly reduce the work that would otherwise have to be done by a person and would typically take hours working through a spreadsheet in order to sort out the logistics of that scheduling. However, now with AI, it's able to take only a few seconds or only a few minutes. So another important tool that's been developed through Unity Health is one that actually is able to summarize patient data and put it into a clear timeline, um, such that instead of having to sift through years and years of patient charts in order to have a comprehensive idea of the patient, this AI tool is able to put many years of patient data all into a clear chronological timeline that a doctor would be able to analyze easily. This could be especially helpful if the doctor perhaps doesn't have a long history interacting with this patient, and can also reduce prep time needed before heading into these appointments. So another application that's also being done in Toronto through Unity Health is patient monitoring. So what they developed is an AI system. It's called ChartWatch. So what it does is it sends notifications to doctors when a patient's status changes, or if they're at risk for their conditioning worsening or needing intensive care. So as such, ChartWatch really acts as an early warning system, where it actually does provide hourly risk scores for the patient so that the doctors can have a clear idea and stay up to date on how these patients are doing or if their care needs to change, um, especially if their health starts to turn for the worse. So this was a system that's actually been around for a few years now. It was launched in 2020 at the St. Michael's Hospital, which is part of Unity Health in Toronto. And since its launch, there actually has been a 26% reduction in the relative risk of death for non-palliative patients that were tested using this. Okay, so another important area to go over as well is the application within virtual health or telemedicine, and certainly these currently and in the future can be very helpful for more rural areas who may not be able to go in person for a lot of appointments. So one of these examples is a virtual assistant, which could be accessed 24/7 and could potentially answer basic questions or common questions about common medical conditions, or if needed, could be able to connect the patient to a healthcare professional, or at least would be able to triage the patient and would be able to tell them what their next step should be in terms of who they should go to in order to access care. Now, another important application is also remote patient monitoring. So this could also be powered by AI, where people could use wearable devices or in order for the identification as well as management of chronic conditions. So that in real time, a doctor would be able to see how the patient is doing without the need for a patient to come in for an in-person visit. So that brings us to our next poll here. So I'm interested to know, how would you feel talking to a virtual assistant? So I'll launch the poll again. Okay. So a few options ranging from very uncomfortable all the way to very comfortable. Okay, some good responses coming in. We'll wait a little bit more and see, wait about 5 more seconds for any last responses, and then we'll show the results. Okay, closing in 3, 2, 1. Okay, so you'll see there's certainly a mix. The most popular response that we did get was that certain people would feel comfortable talking to a virtual assistant, but some people would also feel uncomfortable with that, and uh, a few weren't really pushed in either direction there. So surgery is another area that also shows a lot of great promise within the field of AI. So through taking in data from watching or analyzing millions of different surgeries, it is believed that AI can complement and work alongside a surgeon. So some of the ways that it could help out would be to display information or potentially anticipate events potentially before the surgeon does. It could also display warnings in case the surgeon is about to make a mistake, or at the very least, before the surgeon potentially makes some important incisions. The AI can confirm with the surgeon before doing so as well. And then another application is it could also potentially provide suggestions to surgeons who may be struggling during a difficult case. Okay, so then some future development. So like I mentioned, this is a rapidly changing field, so a lot of it is sort of changing very quickly here. But some ideas for some future developments. So in Canada, there may be future approval of artificial intelligence, which can actually interpret the medical images. So through a radiology analysis of X-rays, CT scans, MRIs, and things like that. And so there has been some approval for this within the US. However, in Canada, there hasn't yet been approval for the use of this. And currently, so neither Canada nor the US have approved the use of programs like ChatGPT, so generative artificial intelligence programs. So neither country has approved the use of this within a clinical setting yet. However, it is expected to probably occur in the future here, as Google, Amazon, and a number of other large companies are developing products that would, for instance, be able to convert the conversations between doctors and patients directly into medical notes. Once again, significantly reducing the amount of administrative time that would be needed for charting and clinical notes and whatnot, so that doctors could potentially spend more time in direct patient care. So Some potential concerns behind this, though, is that if large corporations are behind many of these products, and perhaps these products no longer are profitable, they could take these services off the market, and that's why certain doctors like Bo Wang are developing similar products that are publicly available, such that everyone has access to the code, so that anyone could use them and they wouldn't be able to be taken off the market as well. Um, yeah, so that's sort of an intro, that last point there, and it actually brings us into our next topic of conversation, which will be some of the concerns regarding the use of AI in healthcare. But before we do that, we will have our 10 minutes. Oh, we will have our 10 minutes intermission break there. So once again, feel free to take a break. We will be, I think, perhaps Michael can share the link to the pre-lecture survey within the chat there. So if you would like to fill it out within this time, that'd be greatly appreciated. It certainly helps us going forward and making these presentations as best as they can be for you. Okay, so we will be back in 10 minutes. It looks like it's saying 9:27 to me, so we'll be back in 10 minutes at 9:37. Okay, so everyone have a good break. Okay. Okay, so welcome back, everyone. I hope everyone had a good break there. Yeah, so first I'll just answer. There's a few questions in the chat. I'll just answer those quickly. Yeah, so to clarify, that was just the name of a company. So just an example there. Yeah, the name's not super important, but yeah, just the name of a but just the name of a company there. Um, and that's okay. I'll just answer the second question uh, just for everyone in case everyone had that question anyway. So the question was could I provide a couple examples on how the virtual assistant might work? So a couple of good examples would be, for instance, if someone is having a surgery or something like that, and then after the surgery, they have some questions about if they're feeling a particular symptom, they could ask the virtual assistant whether this is a normal or common symptom for them to be experiencing. That's one potential application. Another could be describing their symptoms to the virtual assistant, and this could help triage the patient, so assess who they need to be seen by, whether they should go to emergency or go see a family doctor or whatnot. Okay, and feel free again to put some more questions into the chat. We have that question and answer period at the end, so feel free to put in some more questions. I just wanted to answer those ones now since they were pretty relevant and we had just talked about them. But feel free to put any more questions in the chat and we will answer them at the end. Okay, so then moving on to the portion on some concerns regarding AI in healthcare. So we did intro this a little bit before the break about some potential concerns regarding corporations or whatnot controlling this technology. Now, I want to hear from you. So what are some concerns you have regarding AI in healthcare? So I will launch the poll again. Okay, so this is not a comprehensive list. It's also select all that apply. So if these or any of these would feel concerning to you, feel free to apply them or select them. There's also another category which you could also feel free to select as well. Okay, there's some good responses coming in. Okay, we'll give it about 5 more seconds here, and then we'll close it down. There we go. A few more responses coming in. Great. Okay, we'll close it in 3, 2, 1 here. Okay, so some common concerns here were issues regarding privacy for AI, some issues with bias, or some mistakes being made by the artificial intelligence. Okay, yeah, so those are the main sort of concerns that we're going to talk about today. So first of which being some privacy concerns, then going into some potential bias concerns, and also some concerns regarding mistakes being made by AI or its application to potentially replace jobs. Okay, so starting off with privacy. So given the potential use of patient data in order to inform the machine learning for artificial intelligence, there are understandably some privacy concerns associated with that, given that it is using patient data. Moreover, another important thing to mention is that there are often public and private partnerships involved in the development of AI. So there are some concerns whether these private bodies will be impacted by alternative motivations that may not prioritize patient privacy. Now, even though much of this patient data that would be used for artificial intelligence or otherwise has been anonymized to begin with, there are new algorithms that have been successfully able to de-anonymize this data. So that is something to keep in mind. And it really does highlight the importance um, to mention the role of regulation uh, uh, and the role of governing bodies as well, where currently, at least, they do their best to regulate and protect patient data. However, oftentimes technology and innovation are able to move faster than these regulations. Now, on the flip side of this, a challenge is also balancing how restricted we want to make the access to this data. Um, as without this data, it could be difficult for the artificial intelligence to develop and actually improve and be useful as a tool going forward. So it's certainly a difficult balance that needs to be struck between ensuring that the AI has enough data to work with so that it can learn and improve and be useful and helpful within the healthcare system, while also balancing that with restricting data or limiting data to ensure that patient privacy is also maintained. So another topic would be the concern of bias. So inherently, artificial intelligence and the machine learning takes information from people, and people themselves often have many different biases. So there is concern of bias then creeping into AI itself. Because, for instance, it has been found that disadvantaged populations, that for disadvantaged populations, certain AI generated predictions may underestimate the need for care or may actually be less accurate when used in these populations. It's also been found that these algorithms can often be biased by social determinants of health. So because of all this, essentially there is the concern that instead of addressing issues in health equity, AI could in fact exacerbate some of these issues. So overall, it is clear again the importance and need for regulators to lay out clear guidelines to ensure that these artificial tools are being regulated and that they can reduce this bias as much as possible in their use. So in addition, there is some concern regarding doctors or nurses being replaced by artificial intelligence, or at least the jobs of doctors or nurses being cut down or minimized. So some things that would favor this eventuality would be if the artificial intelligence would get to a place where it is more accurate, less costly, and more efficient than a doctor or nurse could be um, in providing care. Now, um, going against this would be people's need for compassion and whether they would still prefer or feel comfortable interacting with a human, and if they would prefer that over primarily interacting with artificial intelligence. Now, obviously, no one can predict the future. However, as it currently stands, artificial intelligence is largely being developed as a complement to improve the efficiency of doctors and nurses, and in order to cut down administrative work and certain inefficiencies, like I mentioned earlier, within the healthcare system. So it's not really being developed currently to try and replace jobs, but more so to complement them and improve the efficiency of them. So a common concern that we saw in the poll was that regarding AI making mistakes, or that in this newly developing and constantly changing field, whether this AI has been thoroughly tested and validated enough for use in the general public. And what I really want to take this as an opportunity for is to talk a little bit more about regulation and how this can be done to minimize any mistakes. So how is AI being regulated in Canada to potentially reduce some of these mistakes or issues? So within Canada, artificial intelligence for the use of healthcare is regulated by Health Canada. Now, recently, Health Canada has started regulating AI through describing it as a software as a medical device, or SAMD. So, in doing so, Health Canada is actually able to monitor the development of AI for healthcare purposes, and ensure that they meet strict licensing requirements before they can be used in any healthcare setting. And then going forward, in order to, um, because AI is constantly developing and changing, something that Health Canada is also planning to do is to regulate adaptive SAMD or adaptive AI used in healthcare settings, such that even when this AI is able to learn on its own and develop, it allows Health Canada to regulate these tools within a flexible manner, such that even after these tools go to market and are being used and potentially have changed significantly from what they were initially approved on, Health Canada would still have legal grounds to regulate them and license them and ensure that they meet certain requirements for healthcare use. So we're nearing the end of the presentation here. I would like to do another poll. So I'll just launch it. So after talking about all of this, I just want to see how you're all feeling about the prospects of AI and its use in healthcare. So I'll launch the poll and we'll see how you're all feeling, from very discouraged to very encouraged, or maybe somewhere in between. Okay, we're getting some great responses in, and then I'll give you a few more seconds, and then I'll end the poll here. All right, we'll close it in 3, 2, 1. I'll share the results. Okay, so it seems that the vast majority of you are feeling encouraged, which is great to hear. Some of you are feeling very encouraged, and some uh, sort of either or. None of you mentioned that you were feeling discouraged by the use of AI in healthcare. So that's great to hear. I'll end the poll there. And then that brings us to the end of the presentation and a bit of a summary. So in summary, so AI really is a new and burgeoning field that is constantly changing. So what we did today was give a little bit of an overview, a general overview of artificial intelligence, and then we went into some of its applications within healthcare. And we also talked about a few of the concerns facing the use of AI in healthcare. So essentially, while there are significant benefits and applications for AI within healthcare, it's also important that this be balanced by regulation to ensure both patient privacy and safety going forward. Okay, so that brings us to the end of the presentation. Here is a list of all my references. So you will be getting these slides after the presentation. They'll be available on Dr. Gair's website. So if you do want to look into any of this in more detail, there are the links for your reference. It'll bring it, and then we're heading into the Q&A period here. Before we do get started on that, I'll just, okay. So before we do get started on that, I'll just put it out there again that once again we are doing a bit of research here. So if you are looking forward, if you do want to provide a bit of feedback for us on the presentation, that would be greatly appreciated. Once again, it just helps us improve the quality of these presentations. And yeah, I would greatly appreciate it. So I'll just leave the QR code in the link up there. And I think Michael can potentially, yeah, he just did it. Great. So Michael just put the link in the chat as well. So if you want to fill that out at any point, feel free to do so. You'll also be getting all this in a follow-up email after the presentation. Okay, so let me take a look, see if there's any questions here. Okay, so one of the questions is, what uses are you looking forward to as a new doctor? Yeah, I mean, I'd say a lot of it's very exciting. Once again, we need to see a sort of nail down the practicalities of lots of these and ensure that uh, there is a balance being struck. But I think something that I'll that a lot of current and future doctors would appreciate if it's able to be done in a responsible manner would be the reduction of administrative work. I know many doctors have to spend significant amounts of their time doing this administrative work. So if we are able to cut down on that, that could certainly be beneficial to both patients and doctors, so that doctors are actually having more time in direct patient care and less time charting and doing paperwork that could be done potentially quicker by a machine. So that's certainly an exciting new use in the future. Now, another question we have here is, do you anticipate that using AI will require collection of more information from patients? So feel free to correct me, but sort of how I'm interpreting that question is whether I think AI will need even more information than is even currently being collected during normal office visits and whatnot. Um, I wouldn't say that AI necessarily would need more information than is currently being collected from patients, just in terms of like the general information that's in a patient's medical record. Um, yeah. Um, Yeah, so I wouldn't say they would necessarily need more information than is currently being used in the medical record. I mean, that's like all the information that doctors currently have and are using, and that seems to be effective. So certainly, um, if this AI is to be effective, though, and learn, it will require a significant amount of patient information in order for it to learn and actually provide meaningful and accurate feedback. So once again, that kind of leads us into the whole privacy thing there. So it'll certainly need a fair amount of patient info, but I wouldn't necessarily expect that it would need more than is currently on existing medical records and whatnot. Okay, another question is, can you let me know how AI solved the scheduling in healthcare? Oh, okay. I assume that's talking about our uh, the application in Toronto and scheduling nurses for their different posts and stuff. Yeah, so I'm not sure exactly on the details of that, but I know that I misspoke a little bit earlier. It said that uh, instead of taking a few hours where someone would manually have to go in and sort of sort out all the nurses' different schedules and their different roles and assign it to them, which by the estimates online, they were saying that would typically take a few hours through their AI tool. Again, I'm not exactly sure on the specifics of how that works. But it would only take around 15 minutes or so for the AI to analyze and put all that out there. So certainly just increases the efficiency of that. That was just one current example of how it's currently being used in a Canadian setting. But once again, as things start to develop, I'm sure there'll be even faster applications going forward. What about the use of wearable devices like an Apple Watch? So Are you asking in terms of the so our slide on the virtual or rural health in terms of the in terms of patient monitoring for chronic conditions and that, or I'm not sure I fully understand your question there. Yeah, for that. Okay. Um, yeah, I mean, so for the use of wearable device like an Apple Watch, I mean, as far as whether Apple themselves will be advancing the Apple Watch such that it incorporates AI more to where it would actually be used as a medical device. I'm not sure if that's a direction that they're going, but I think primarily when we talk about stuff like that, it's more specific medical devices that were made for the purpose of monitoring patient health, and then just using AI to sort of power those. But uh, 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 and that would probably likely be the first step to for that to be done in sort of a medical setting. But who knows? Perhaps Apple is able to develop a medical device like that that could be approved by Health Canada and whatnot. But I think at the moment we're thinking more sort of just general medical device companies and whatnot making AI powered tools for patient monitoring. Okay. Any more questions at all? Feel free to put them in the chat there. I will. We did finish a bit early, so once again, we definitely have some time for some questions. But if not, can also let you go a little bit early here to enjoy your Saturday. So either way is okay. Okay, well, maybe give it another minute or so, see if there's any last minute questions coming in. But if not, then we will wrap up the presentation there. Okay, great. Um, yeah, okay. It doesn't look like too many more questions are coming in, so I think we'll start to wrap up the presentation then. Yeah, so once again, thanks everyone for coming in today. Um, oh, right, okay. Just yeah, then just some general logistics stuff before we wrap up here. So Dr. Gair did just want me to mention to you that there are sort of certificates that we can give you sort of as a fun little thing for the for completing these mini med school sessions. So this is the last mini med school session for the year here. So thank you all for attending. Dr. Gair, I'm not sure if there's more. I'm not super sure on the specifics of these certificates and whatnot, so I'm not sure if you would like to speak more on that, or if you want me to dive into that a bit more. But
Yeah, I mentioned in an email to you that we just need their names. We need the names as they would like them to be presented. So we could also follow up with an email to everybody who's participated, but that if they would like a certificate, they'll need to provide the name that they would like on that certificate.
Perfect. Sounds good. So yeah, if you would, so we will be doing a follow-up email with a lot of different information in it. So once again, we'll have a link to the post-lecture survey, as well as a link to the recording and these PowerPoint slides, which will be posted online. And then we can also sort out any of the certificate stuff if you guys would like. And as Dr. Gair mentioned, we would just need your name as you would like for it to be presented on the certificate. But yeah, other than that, I think if there's nothing else, I think that pretty much wraps up everything. So thank you, everyone. We really appreciate it for everyone coming to all of our sessions this year. It's been great. So we've certainly learned a lot, and through your feedback in the forums or otherwise, we really value it. And yeah, we'll certainly use that going forward to improve the presentation. So I think that brings us to the end of today. So thanks again, everyone. I just look out for the follow-up emails. And thanks again. Enjoy the rest of your Saturday.
Yeah, thank you, everyone. Just from me as well, thank you all for your time and participation. Take care.